Here's a question I get asked more than almost anything else in my practice, but rarely in a straightforward way. What actually happens to your body when you're intimate or engage in self-pleasure every single day? Does it help you? Hurt you? Does it affect your energy, your hormones, your prostate? If you're over 60 and you've been wondering about this but didn't know who to ask, I'm glad you're here because today I'm going to give you the honest, science-backed answer that cuts through all the myths and misinformation. I'm Dr. Narita, a urologist with 12 years of experience helping men understand their bodies without embarrassment or judgment. And what I'm about to share might change how you think about your own habits. Before we go any further, hit that like button right now, drop a comment telling me where you're watching from, and if you haven't subscribed yet, do that now. Trust me, you'll want to stay for what's coming. Let's get started. All right, let's address the elephant in the room. You've probably heard conflicting information about this your entire life. Some people say daily activity drains your energy and lowers your testosterone. Others say it's essential for prostate health and you should do it as often as possible. So, what's the real answer? Here's the truth most men don't understand. Daily activity isn't inherently good or bad. What matters is how your individual body responds, what your overall health looks like, and whether your habits are supporting your well-being or working against it. Let me break down what's actually happening inside your body. When you engage in intimacy or self-pleasure, your brain releases a cascade of chemicals: dopamine for pleasure and motivation, oxytocin for bonding and relaxation, endorphins for mood elevation, and after climax, prolactin, which creates that calm, satisfied feeling and temporarily reduces your desire. Your cardiovascular system gets a mild workout. Your pelvic muscles contract and release. Your prostate gland empties some of its stored fluid, and your body enters a brief recovery phase where it rebalances hormones and replenishes what was used. For most healthy men, this entire process is beneficial. It reduces stress, it supports circulation, it helps keep the prostate functioning properly, and it can even improve sleep quality. But here's where things get more complicated. If you're engaging daily and you're noticing persistent fatigue, reduced interest, difficulty achieving satisfaction, or physical discomfort, those are signs that your body might need more time to recover between sessions. Not because there's anything wrong with you, but because your hormones, nervous system, and tissues need adequate recovery time to function optimally. The key is understanding your body's signals, not following arbitrary rules, not comparing yourself to anyone else, just listening to what your body is telling you. And that's exactly what we're going to explore today. Let me tell you about a conversation I had just last week. A man in his mid-60s came to see me. He seemed uncomfortable bringing up the topic, but he finally asked, "Doc, I've been intimate with my wife almost every day for years. Lately, I've been feeling tired, and I'm wondering if that's the problem. Should I stop?" I asked him how he felt immediately after intimacy. He said, great, relaxed, connected to his wife." Then I asked how he felt the next morning. He paused and said, "Actually, pretty good, energized even." That's when I explained something important. The fatigue he was experiencing wasn't from his intimate life. It was from other factors: poor sleep quality, some dietary habits, and mild dehydration. His body was handling daily activity just fine. In fact, it was one of the healthiest parts of his routine. But I've also had patients who come in with the opposite story: men who engage daily and feel increasingly drained, irritable, or disconnected. For them, spacing things out to every other day or a few times a week makes a dramatic difference in how they feel. There's no universal answer, but there are patterns, there are warning signs, and there are adjustments you can make to optimize how you feel. That's what I want to walk you through today. The 5 most important things every man over 60 should understand about frequency, recovery, and maintaining vitality in this area of life. Mistake number 5, not recognizing the difference between physical desire and habitual behavior. Let's start with something subtle but incredibly important. Most men don't realize there's a difference between true physical desire and habitual behavior, and over time, especially if you're engaging daily, the line between the two can blur. Here's what I mean. True desire comes from your body's natural rhythms, your testosterone levels, your stress levels, your overall energy. It's spontaneous. It feels genuine. It enhances your mood and connection. Habitual behavior, on the other hand, is something you do because it's part of your routine. Maybe it's the same time every day. Maybe it's triggered by boredom, stress, or just the fact that you've been doing it for so long that it's automatic. There's nothing morally wrong with either one, but here's why the distinction matters. When activity becomes purely habitual, you might not be getting the same benefits anymore. Your body might be going through the motions without the same hormonal response. the same stress relief, or the same satisfaction, and over time, that can lead to diminishing returns, less pleasure, more effort, and even some frustration. Biologically, what's happening is that your dopamine receptors can become less sensitive when you're getting the same reward. Repeatedly without variation or genuine motivation, your brain starts to expect it rather than truly desire it. Here's what I want you to do. Pay attention to whether you're engaging because you genuinely feel desire or because it's just part of your routine. If it's the latter, try taking a break for a few days, not as punishment, but as a reset. Let genuine desire build naturally. Again, you might be surprised at how much more satisfying it becomes when it's driven by real desire rather than habit. Mistake number 4, overlooking the impact on your cardiovascular and energy systems. Now, let's talk about something most men don't connect: the relationship between daily activity and your cardiovascular and energy reserves. Here's the reality. Intimacy and self-pleasure do require energy. Your heart rate increases, your blood pressure rises temporarily, your muscles work, your nervous system activates, and all of that requires fuel from your body's energy systems. For a healthy man with good cardiovascular fitness, this is completely manageable. It's actually beneficial, like a mild workout that supports heart health and circulation. But if you're dealing with cardiovascular issues, if your diet isn't providing adequate nutrition, if you're not sleeping well, or if you're already running on empty energy-wise, daily activity can start to feel like a drain rather than a boost. Here's what's happening inside your body. Your mitochondria, the energy factories in your cells, need adequate nutrients, oxygen, and recovery time to produce energy efficiently. If you're asking your body to perform daily without giving it the resources it needs to recover, you're going to feel fatigued. And for men over 60, this recovery process naturally takes a bit longer than it did when you were younger. That's not a flaw, it's just biology. So here's the fix. First, make sure you're eating enough protein, healthy fats, and complex carbohydrates. Your body needs fuel to recover properly. Second, prioritize sleep. Most of your hormonal recovery and energy restoration happens while you're sleeping. Third, pay attention to your cardiovascular health. If you're noticing shortness of breath, chest discomfort, or excessive fatigue during or after activity, talk to your doctor. Those could be signs that your heart needs attention. And fourth, if you're feeling consistently drained, try spacing things out to every other day. Give your body more time to fully recover. You'll likely find that you actually feel better and enjoy it more. Mistake number 3, ignoring the health of your prostate gland. Let's talk about your prostate. You've probably heard that regular activity is good for prostate health, and that's generally true. Regular emptying helps reduce congestion in the gland, which can lower inflammation and potentially reduce the risk of certain issues. But here's what most men don't realize. Frequency alone doesn't determine prostate health. The quality of the activity, how forceful it is, how long it lasts, and how your prostate feels afterward all matter just as much. If you're engaging daily and your prostate is already enlarged or inflamed, you might actually be creating additional irritation. The gland needs time to refill with healthy fluid and recover between sessions. Here's what happens biologically. Your prostate produces fluid that makes up part of your body's natural response during intimacy. When you engage frequently, the gland is constantly producing and emptying. If it's already under stress from enlargement or inflammation, that constant demand can make symptoms worse. Increased urgency, discomfort, difficulty urinating. On the other hand, going too long without activity can lead to congestion, where old fluid sits in the gland and contributes to inflammation. So, what's the sweet spot? For most men over 60, 2 to 4 times per week is ideal for prostate health. That frequency is enough to keep things moving without overworking the gland. Here's what I recommend. Pay attention to how you feel after activity. If you're noticing increased urinary urgency, discomfort in your pelvic area, or difficulty urinating, try spacing things out a bit more. And if you're already dealing with prostate issues, talk to your urologist about the best frequency for your specific situation. There's no shame in asking. It's a normal part of maintaining your health. Mistake number 2, neglecting pelvic floor muscle recovery. Here's something most men have never thought about. Every time you engage in intimacy or self-pleasure, your pelvic floor muscles are working hard. They're contracting, supporting, coordinating the entire process. And just like any other muscle group in your body, they need time to recover. For men over 60, especially if you're dealing with any bladder control issues or prostate enlargement, those muscles can get fatigued more easily. And when they're fatigued, you might notice things like weaker sensations, discomfort during or after activity, or even worsening urinary control. Here's what's happening inside your body. Your pelvic floor is a hammock of muscles that supports your bladder, bowel, and reproductive organs. When you engage daily, those muscles are contracting repeatedly without much rest. Over time, they can become tight, weak, or dysfunctional. Tight muscles don't relax properly, which can cause pain or discomfort. Weak muscles don't contract effectively, which can affect bladder control and the quality of your experience. So, what's the solution? First, if you're engaging daily and noticing any discomfort or changes in function, try giving those muscles more recovery time. Space things out to every other day. Second, start doing pelvic floor exercises. I know you've probably heard about Kegels and ignored them, but they really do help. Stronger pelvic floor muscles recover faster, perform better, and support better bladder control. Here's how to do them. Contract the muscles you'd use to stop urination midstream. Hold for 5 seconds, release for 5 seconds, repeat 10 times twice a day. And third, if you're experiencing persistent pain or dysfunction, see a pelvic floor physical therapist. Yes, they exist, and yes, they can help. This isn't something you have to just live with. Mistake number one, letting shame or outdated beliefs control your choices. And now, the most important one. The biggest mistake I see isn't about biology or frequency or technique, it's about mindset. Too many men carry shame, guilt, or embarrassment about their intimate lives. They've internalized messages that intimacy is somehow inappropriate after a certain age, or that there's something wrong with self-pleasure, or that wanting physical connection means they're being selfish. And that shame creates stress. Stress affects your hormones, it affects your mood, it affects your relationship with your partner, and it can even affect your physical health. Here's what I need you to understand. There is nothing wrong with having desires at any age. There is nothing shameful about taking care of your needs, whether with a partner or on your own. And there is no expiration date on intimacy, pleasure, or connection. What matters is that your habits are healthy, consensual, and aligned with your values and well-being. If daily activity makes you feel good, doesn't cause physical problems, and enhances your quality of life, then there's no medical reason to stop. If you prefer less frequency, that's equally valid. And if you're navigating changes in desire or function as you age, that's completely normal. There are solutions, medications, lifestyle adjustments, communication strategies with your partner. You get to define what a healthy, intimate life looks like for you. Not outdated cultural messages, not guilt, not pressure from anyone else. You. All right, let's make this practical. Here's your action plan starting today. Step 1. Monitor your body's response for the next 2 weeks. Pay close attention to how you feel after intimate activity. Notice your energy levels, your mood, your physical comfort, any urinary changes. This will give you valuable information about whether your current frequency is working for you. Step 2. Find your personal optimal frequency. If you're feeling consistently fatigued or uncomfortable, try spacing things out to every other day. See if that makes a difference. If you're feeling great with daily activity, keep doing what you're doing. There's no need to change something that's working well. Step 3, support your recovery. Make sure you're eating well. Prioritize protein, healthy fats, and vegetables. Stay hydrated. Get 7 to 8 hours of sleep each night. Your body needs these resources to recover properly. Step 4, strengthen your pelvic floor. Start doing pelvic floor exercises today. Contract. Hold for 5 seconds. Release for 5 seconds. 10 repetitions twice daily. Give it 2 weeks and you'll notice a difference in strength and control. Step 5, release the shame. If you're carrying guilt or embarrassment about your intimate life, work on letting that go. Talk to your partner, talk to a therapist if needed, reframe your thinking. Your desires are normal, your needs are valid, and you deserve to enjoy this aspect of life without shame. I want you to hear something important. If you've been struggling with questions about frequency, desire, function, or any aspect of your intimate life, you are not alone, and you are absolutely not broken. What you're experiencing is part of being human. It's part of the natural changes that come with aging, and it's something that can be understood, managed, and optimized with the right information and support. I've worked with countless men who thought their intimate life was over, who thought they'd never feel desire again, who believed they had to choose between physical comfort and connection with their partner, and I've watched those same men rediscover their confidence, their vitality, and their joy with simple adjustments and a shift in perspective. You deserve that same experience. Your age doesn't disqualify you from pleasure, connection, or vitality. Your past doesn't determine your future. And the challenges you're facing right now are not permanent roadblocks. They're just signals that your body needs something different. And when you listen to those signals with compassion rather than judgment, everything changes. So here's what I want you to do right now. Take a deep breath, let go of any shame or guilt you've been carrying about this topic, and commit to treating yourself and your body with the respect and kindness you deserve. You have the power to make choices that support your health, your happiness, and your vitality at every age, and it starts with understanding your body and honoring what it needs. Before you go, do me a favor. If this video gave you clarity or helped you in any way, hit that like button, drop a comment, and let me know where you're watching from. I genuinely love hearing from you. And if you haven't subscribed yet, subscribe now, because I'm here to give you the truth about your health without judgment or embarrassment. Your best days aren't behind you, they're right in front of you. And they start with understanding your body, respecting your needs, and making informed choices that support your well-being. Take care of yourself. You're absolutely worth it. I'm